All right,
Great.
and
Well,
we'll
thank
pass
you.
the meeting over.
Okay, thank you, moderator, very much, and thank you everyone for being here. And I'm very excited to get this started. It's been a bit of a timeline, but we're on it, right? It's exciting. We're excited to be here. I did want to go ahead and, I guess, Jessica, would you like to call the meeting to order? Is that important for this, or do we need
We
to?
don't need it. We don't need to establish any quorum because it's just the two of you, but go ahead and call the meeting to order.
Okay, well, I'd like to go ahead and call this meeting to order and welcome, thank you, Diane, for your part in this and for working hard on this. I think that I do have a PowerPoint slide. I'm going to ask that they show that. I'll just do a kind of a brief opening statement and kind of a review of why we're here, and then we'll get going. So I guess if I could have the moderator show my slide deck.
Sure, one moment while we get that set up. And then would you like me to pass over presenter?
Yeah, I guess, and then I'll go ahead and advance it myself. Is that what you're saying?
Correct.
Sure. See if I can make that work. I'm not sure I know how to make that work.
If you hover your mouse over to the left-hand side, there should be little arrows that'll let you advance the slides.
Okay. Yeah, it's not showing me arrows. How about if you advance? I'll just ask you to, if you don't mind.
Okay, thanks.
Great. Okay, we'll go to the next slide. Thank you. So I just wanted to remind us as we get going on this task force what the mission of the Veterinary Medical Board is. It is the protection of California consumers and their animals through the regulation of veterinary medicine. This comes right out of our mission statement on the website. Go ahead and advance. So we fulfill this mission by developing, maintaining, and enforcing professional standards regarding licensed veterinarians, RVTs, veterinary assistant controlled substance permit holders, and veterinary premises. So our mission is very, I think, focused, and I think that our range of actions that we can take is also very focused on the professional standards that we develop, maintain, and enforce. Okay, next slide. So we actually got this started. The board voted to start this last January, but we had then one of our members was sunsetted out or was replaced because her term expired. Thank you, Alana, for all your help, but she was termed out, and then we actually had to kind of regroup after that. And Diane, thank you for stepping up and joining the task force. Very excited to have you on board. Again, there was a bit of a controversy. I think some of us on the Veterinary Medical Board were looking at this as an MDC job, and some of us felt like it was really a job of an individual task force, and it was voted on to become a task force, so that's why we're here. The objective of this task force is to determine actions that the Veterinary Medical Board can take to increase access to veterinary care for consumers and their animals. So that's kind of what we're focused on and what we're hoping to accomplish with our task force. Okay, next slide. A couple of things that we did recently towards this would be the Assembly Bill 1535, which will decrease barriers for out-of-state licensees to become licensed to practice in California. This basically eliminated the barrier of the state board exam, which we knew was a barrier for other veterinarians in other states to come into California. We will, starting January 2022, use the national exam or proof of recent practice experience. We still do require the mail out small veterinary law exam that we feel is very important for new practice, new licensees to know what's happening specific to California. So, but that should hopefully make a difference in access to veterinary care. Okay, next slide. We also,
Dr. Nolan, just real quickly, sorry. We have the agenda item for public comment for items not on the agenda. Can we just jump to that real quick before we continue?
Sorry, I missed that. Yes, thank you for stopping me, and we'll go ahead and open up for public comments not on the agenda.
All right, this is the moderator, and at the direction of the task force, I have opened up the Q&A panel for public comment for items not on the agenda. If you would like to make a public comment, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen, and please type comment and send to all panelists. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, and I do have an individual who has requested public comment, Karen Atlas. All right, Karen, I'll be requesting to unmute your microphone. Please click that unmute me button when the prompt comes up. Karen, I'm gonna request to unmute your microphone again. Please click that unmute me button when the prompt comes up on your device. It appears that Karen's not getting the prompt. Oh, wait, now you are unmuted.
Hello, thank you for taking my public comment. My name is Karen Atlas, and I am the president of the Animal Physical Therapy Coalition. We are a coalition who represents DVMs, PTs, RVTs, and consumers who are like-minded in our approach to increase safe access to properly trained and licensed physical therapists. We have submitted a document last week for your consideration, which includes letters by DVMs and consumers who recognize the need for more access to rehabilitative services. We have been sounding the alarm relating to the access to care crisis to the Veterinary Medical Board for many years, even way before the pandemic. COVID-19 has made access exponentially worse. The regulations that were passed earlier this year by the VMB have made things yet even worse. And if they go into effect, they will be responsible for closing the doors of rehab facilities that are currently working lawfully, which will of course exacerbate this issue. We are encouraged that an access to care task force has been created so the facts can be realized that this truly is a crisis in California. Other states have solved this issue through swift changes in legislation, and it has worked well to improve the access to care. In 2018, a legislative bill, AB 3013, would have done a nice job in alleviating this problem, but the VMB opposed it, and unfortunately, they based their opposition largely on misinformation they were given. Consumers can't get the care and choices they want and need, and we've submitted a petition with thousands of signatures, and DVMs are not able to interprofessionally collaborate with qualified PTs as they have been asking for as well. We will continue our quest to increase consumer access to rehab services and hope that the VMB will come to understand that this truly is a crisis. The good news is that the resolution is not insurmountable. It can reasonably, adequately, and safely be addressed in legislation, and we look forward to being involved in coming to a workable solution. Of note, the board will be asked to consider the final proposed regulatory language as it relates to animal rehab at their meeting on October 21st. We implore you to put a hold on all animal rehab language, which again, if enacted, will reduce access even further, until a proper legislative solution is put in place. By merely putting a hold on this language will at least serve to not make the access to care issue even worse during this time of crisis. Thank you so much for your consideration.
All right, this is a moderator, and we will go on to our next individual who has requested public comment. Individual identified as GV Ayers. I will be requesting to unmute your microphone. Please click that unmute me when the prompt comes up on your device. All right, and you are unmuted.
Good morning. This is GV Ayers. I represent the Animal Physical Therapy Coalition, and I work with Karen Atlas regarding the coalition issues before the coalition and issues here before the legislature, before the legislature and before the Veterinary Medical Board. And I just wanted to identify myself with her comments. And we believe that there are workable solutions. And although the board has opined that they can't do it through their regulations, we believe there are ways that it can be done, and that it has been actually safely. It can be done safely through existing law, but we believe also that it does need some legislation as well. And so we would encourage you to work with toward a legislative solution, which we will be working toward. And thank you so much for your time.
All right, this is the moderator, and that appears to be our last request for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you.
All right.
And I want to thank you for keeping this conversation in front of us, and we look forward to further conversations on this in the future. I also want to apologize for skipping over the public comment, so it's done unintentionally. So I'll go back to my PowerPoint slideshow, and basically the next slide talks about other actions that we are in the process of taking to increase access to veterinary care. The board did approve an electronic veterinary services legislative proposal that will hopefully more clearly define telehealth, telemedicine, and teletriage, and help us educate veterinarians and consumers on what is available and how that can help access to care. Hopefully, next slide. So I did add some, and again, this was not a comprehensive review of everything out there. These were just some things that I have run into that I wanted to share to get us started in this process. And this document here, this Access to Veterinary Care report, is a collaboration between Maddie's Fund and the Access to Veterinary Care Coalition. It's a fairly long document, so there's a lot of meat to it. It's basically a national population survey, and it really is trying to help us take a look at barriers to veterinary care from all different standpoints, including from the veterinarian standpoint, from consumers, from regulatory agencies, et cetera. And it really, I think what it really did for me is it really brought home some of these statistics that made it obvious that at least nationally, we're really facing a crisis. I'll just highlight a few of the things. In the past 2 years, 1 out of 4 households, that's 27.9%, experienced barriers to veterinary care. If you look at lower income households, that goes up to 1 out of 3, or 33.7%. Experience barriers, and their average, basically they reported that they were unable to get basic preventative care. They define that as an annual exam, health exam, vaccinations, heartworm, flea, and tick preventative, parasite prevention. So just basic health care. 2.4 times in the past 2 years, lower income households reported 33% reported they were unable to get basic care. When they were looking at sick care, those households said 13.6% of the time they were unable to get basic care in the last 2 years. And then emergency care was a little better. 7.7% said they were unable to get emergency care in the past 2 years. So, but it really brings home the idea that there is a very significant socioeconomic inequity in this as well. 80% of those reporting an inability to get care reported that it was financially based. 80%. So that was by far the most common reason why they could not get care. There was some differences in pet owners in the West, but the report doesn't do at least I was unable to really glean some of the nuances that California might have compared to the rest of the nation. And I thought that might be somewhere to start to try to get some more data and information as to what's specific to California that we could perhaps address. The only thing that they pulled out of this report was the pet owners in the West were less likely to mention heartworm, flea, and tick control as having an inability to get access to that. It was 44% said they had trouble with that versus 53%. So to me, I would love to see a little more data and a little more specific data for California. I'm going to go ahead and open it up now, Diana, and we should introduce ourselves. I'm Jamie Nolan. I've been on the Vet Med board for a term and a half at this point, and have both a small animal and large animal background, though I would say I probably have spent more years in a large animal background than small. And I'll turn it over to Diane. She can introduce herself.
Yeah, hi, good morning, everyone. My name is Diana Prado. This is my first term on the Veterinary Medical Board, and I'm excited to be on this task force. And by background, I'm a housing rights attorney that specifically focuses with tenants with pets. And so this is also very near and dear to my heart in making sure that just like access to legal services is the same as access to veterinary care, and making sure that consumers are able to access the veterinary care that's available, and working together with everyone to make that possible. So excited for all of this. Thanks.
Great, thank you. So again, we are actually on item number 5 on the agenda, 5A, and I just wanted to open it up for public discussion. Anything that the public would be like to talk to that might have come out of this access to veterinary care report.
All right, this is a moderator, and at the direction of the task force, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment, please click that icon with a question mark within a square located at the bottom right-hand corner of your WebEx screen. I'll go ahead and pause a moment to allow the public time to access that Q&A panel and submit their requests. All right, it looks like I have a request from individual identified as Robin Post. Robin, I'll be requesting to unmute your microphone. Please click that unmute me button when the prompt comes up on your device. All right, and you are unmuted.
Hi, I'm just wondering where we can find that report you just mentioned.
Very good. If you go to the Veterinary Medical Board website, you'll see this meeting was posted, and and if you click on the agenda, hopefully you have that in front of you, there's links right there on the agenda to that report. So have you been able to access the agenda?
Yes.
Okay, so if you go down to 5A, you'll see there's a hot link, and that should take you to the report. If not, we can try to directly email it to you.
Okay, thank you.
You bet.
All right, this is a moderator, and it appears that was our only request for public comment. Would you like me to close that Q&A panel?
Yes, thank you. Okay, so actually, back to my slide set, there's a slide that I put on there about Align Care, and I'm hoping that that we'll get some more public comment on this. You can keep going one more. So there was quite a bit of discussion and a presentation at the CVMA task force about Align Care, and this has some really fascinating possibilities in my mind, because it actually uses social services as well as private foundation donor, funding, and veterinary service providers to work together as a team to try to allow access to veterinary care to families that may not be able to handle that on their own. And I think it's a really a great idea. Kind of they've used this sort of a One Health paradigm, which I think is very fitting. Because I think it really helps to recognize using already established protocols, who is most, you know, in need of some funding, and then have that funding be made available. It's kind of a co-pay system, and I'm hopefully I have people that understand it even better talk about it. But so a family that has qualified for this service and is in need of veterinary assistance or veterinary service is able to take their animal into recognized providers, and they pay a co-pay amount of money. And then the funding, the philanthropic organizations that are funding this come up with the rest of the funding. So I think that's another, interesting idea that is, I think, very relevant, and would love to have public comment on that as well. So if we could open it up for public comment, that would be great.
All right, this is the moderator, and at the direction of the task force, I have opened up that Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. I'll pause a moment to allow the public time to access that Q&A panel and submit their requests. All right, it looks like we have a request from Dr. Sharice Roth. And Dr. Roth, I will request to unmute your microphone. Please click that unmute me button when the prompt appears. All right, and you are unmuted.
Chief Veterinary Officer of Fuzzy Pet Health. So we are primarily a telehealth, teleinformation provider for pet parents. In the aligned care model, it does still lean on the assumption that a pet parent knows which direction they're supposed to go as far as making decisions on being able to seek care and things like that. And so my primary question is the goal, by bringing this into something that we're going to do in California, to pair that family also as a part of that model with telehealth providers in order to be able to help them make that decision. As you probably have known, based on the research I'm sure you've been doing for a lot of these families, it's still trying to decide, do I take less paycheck home, miss work, those sorts of things? Is this appointment really important? And so I was wondering, have you guys given thought to how you want to help with the decision-making process to even getting that family to the point where they're in front of a care provider?
That's an excellent point, Dr. Roth. And also the study that we talked about earlier did show that younger pet owners also struggle with the lack of knowledge of what kind of help to seek also, as well as, at least that the statistics in that study showed that there was a higher percentage of younger pet owners that weren't even sure where to go and what to ask for. Is that kind of what you're saying? I'm assuming.
It is, but also just from a socioeconomic aspect of this, right? And that there still has to be that decision made of getting in front of the care provider, and that I'm under the assumption that with having these dedicated facilities or these dedicated clinicians, you're probably still seeing the same things we're seeing in clinic, in that staffing those can be difficult. And so even basic things such as being able to provide temporary pain relief or flea and tick prevention, those sorts of things, so that we're not worried about zoonotic issues passing to the family members. Kind of where do you land on kind of that pre-care aspect in order to get these people what they need and these pets what they need?
So let me turn the question around back to you and ask you, because it sounds like you're really in the trenches, right?
Yeah.
How do you see the Veterinary Medical Board playing a role in that educational process? Do you think we have any access to those pet care, to the pet owners, or do you think we have access to get information to them? How would you see that happening?
Yeah, so what I can tell you, I mean, we go through thousands of these interactions with pet parents weekly, and over half of the people that we are touching base with, either proactively, if they've ever come in, we check on the pets, those sorts of things. Over half of them do not have a veterinary client-patient relationship to speak of, but still have very much so the need for that veterinary consult in their lives and in their pets' lives. And so I would venture to say that probably partnering with a telehealth provider because we are often that first line of being able to get that pet to the care that they need. So that would be kind of my thought process around it. And these pet parents are, as you can probably imagine, worried if it does happen to be a sick topic, but often it's just a lack of direction and the ability to actually even get in, even if they're willing to go. So like those sorts of things are things that, like Fuzzy, we can do well if they do happen to have a veterinary client patient relationship, helping them be able to suss out what needs to happen. But even before that, educating them on really the lay of the land as far as that pet is concerned and being that telehealth partner. So I do think that that's something, and we would be happy to, help with piloting that as part of this and, working out what that needs to look like. Because truly it is it's great that once they are able to get to that appointment, that they're able to have that support. But often the question is, do I need to go, especially if I'm an hourly or wage worker, except that, yes, I'm going to have to pay this copay, which is less than what I would normally pay. But also there's that kind of 1-2 punch of it being that their paycheck is going to be less if they're an hourly worker by taking that step into the clinic. So those are types of things that I think that we could really partner strongly with the veterinary board in order to help kind of bridge that gap between, I think my pet needs care, I think my pet needs something, but I'm unsure, to getting them to that point where they are able to pay that copay or that sliding scale.
So let me ask you, if you don't mind, so in your practice, is the telehealth consultation free?
So yeah, great question. So for any family, they have a 7-day free trial, which allows for that pet parent to ask any pressing questions without having to worry about pay if that's the issue. If they are partnered with one of our partner clinics, then they pay $79 a year for unlimited access to our teams. And so that is by video, that is by chat, and it is 24/7. If they come to us organically, let's say they Google a pet question and we come up, then it's typically $99 a year. And even with that, that ends up being around $8 a month for that unlimited access to veterinary knowledge and veterinary support, which seems to be, based on the pet parents that we're in connection with, seems to be that right price point for them to be able to do that. They do have a monthly option as well, but by far we have more annual members because of that lower price point for them. And of course, for members of, like, if this were going to be a pilot and such that we want to learn more about kind of what this aligned care can do in the state of California, we would be able to modify that however we need to, because the goal here is getting those pets access to the care that they need.
And do you at this point have any idea as far as the socioeconomic status of clientele, or is there any way to parcel that out? Or
in the last study that we looked at, our average family income was around 70,000, and I think that was falsely high because it was primarily based in the San Francisco Bay Area, and so I do think that there's likely more demographic socioeconomic data that we can glean from doing a really directed pilot to know what the level of impact is for families that are at a lower socioeconomic status.
Sure. Thank you very much. Diane, do you have a question for her? You look like you were.
No, it just kind of made me think about, as I'm listening to all of this, is really what I'm hearing is that there's a huge need for education and outreach, prior to also veterinary care services. So being able to, work with you, Dr. Roth, and with other agencies, rescue groups and different type of groups to be able to provide education on preventative care, just the laws that apply of being a good pet owner, and that component. And so not sure, I'm like, and this is great because we're just brainstorming ideas to figure out how, we can all put this together and what role the Veterinary Medical Board takes. But I think that education and outreach is a huge component in getting to access to care, not only to being able to, well, where do I even go? Where's the place that I can go? But just that information, as you were saying, Dr. Roth, in regards to preventative care, right? Do I have to go to a vet to get flea and tick medicine, or can I get that somewhere else? So it'd be great to work together with some more vets to see how we can get some education and outreach going out there, because that's what I kind of heard was a big ask?
Yeah, and I think that the other aspect of what we do, of course, we're there 24/7, like I said, either by video, escalating to a doctor, but primarily these are going to be veterinary technicians. Even outside of that one-on-one interactions, we do have our academy that we call it, our Fuzzy Pet Care Academy, where it covers those exact things, Diane, and that it does go over just good pet parent knowledge, of why is chocolate bad, all of those types of things, all the way to what are the things that you need to be looking out for if your pet is not on flea and tick prevention. What are the things that you need to be worried about for your family? And so I do think that even leveling the playing field a bit, and that we know that topical EPA regulated flea and tick preventions are not as great as oral flea and tick prevention. And so is it even that's a first step into starting to lean into these pet owners and saying, hey, let's keep your family safe from a One Health point of view, simply by being able to have appropriate questionnaires around flea tick prevention, socioeconomic status, and being able to provide that pet or that pet family with the things that they need. I should also mention that yearly subscription does cover the entire pet family. So it's not like they have to do this for every single pet, that it covers the entire family. And so that's another aspect of that I think that the board could step in and say, maybe we limit it to flea, tick, and heartworm prevention, and even hand select the ones that are applicable, and using that as the metric of, are we able to get these pets on flea and tick prevention? Are we seeing a decrease in disease processes or skin issues in their human entity, in their human family, as well as the pet family, using this One Health approach?
Great. Thank you very much for sharing.
My pleasure. Thank you for the time.
Any other public comments or discussion?
This is the moderator. Appears there are no further requests for public comment. Would you like me to close that Q&A panel?
Yes, I'm surprised that I don't have any public comment from Dr. Miller. I thought for sure, Grant, you would jump in on this one, but doesn't look like he is. So we'll go ahead and close it. Oh, wait a minute. His hand went up. I knew it. Okay, what's going on?
Let me go ahead and request to unmute Dr. Miller. All right, you are unmuted.
Good morning. Can you guys hear me okay?
Yes, sounds good. Thank you.
I'm really excited to listen to this meeting. As you know, the CVMA also is convening an Access to Care task force meeting that will take place a little later this month. I think for us, we're still in a learning phase too. And so it's hard to make a lot of comments at this point because we're just kind of absorbing this entire topic. And using the Access to Veterinary Care Coalition's document as well to kind of educate ourselves. But we've put together a group of veterinarians and registered veterinary technicians who really have experience in this area. And we're hoping to be able to dovetail some of our efforts with what your board is doing so that we might be able to work together on this topic. I'd like to reserve the opportunity to come back and report back to your full board after we have our first task force meeting. And Dr. Nolan, I'm hoping you'll be able to assist me with that because you are invited as a VMB representative to our task force to take part in that. So
sure.
Stay tuned. We are definitely interested in this topic and would very much like to help provide some solutions and find some opportunities to increase access to care.
Great. Thank you very much, Dr. Miller. And I look forward to that task force committee as well. And I think you put it very succinctly when you said we're still in the learning phase. I think that's sort of how we feel too. We're thinking that it might be really helpful to try to collect some California specific data and perhaps using some of these other reports as a template or for ideas. as we move forward. We're excited about that. We actually have a representative from the Tufts at Tech program, but he can't make it till 11:30, so he may not. We'll see how long this meeting goes and whether we'll be able to have him present a short presentation and tell us about what they're doing back in their program. So we're trying to get, I think moving forward, I'd like to get more presenters from different programs across the country as well. I think Diane and I are thinking that the more we learn from other programs, the more creative our ideas will be, and hopefully moving forward. So thank you for sharing. Any other public comment?
This is the moderator. I don't see any other hands raised.
Okay, thank you. If you want to go to the next slide, which is actually involves Tufts at Tech. So the name is actually indicative of the program. So Tufts University has a veterinary medical program, and they are actually paired up with Worcester, probably say that wrong, Worcester Technical High School. So the tech part stands for the high school, and that technical high school is doing a lot of training for veterinary assistants. And they have partnered then with this vet school, and they actually have a very substantially subsidized clinic for clients. And they also, the clients are screened through the public or the social services. So they do have to qualify based on need, financial need. And then they operate this clinic, and the veterinary students and the technical high school students work together under the supervision of a licensed veterinarian to provide a tremendous amount of basic access to veterinary care for mostly financially needy clients. So I think it's a really interesting program, and I think what made me think about it from a standpoint of California is the number of registered veterinary technical programs we have in the state as well, and perhaps the ability of those programs to help as well in providing access for basic care and education to clients within their area. I don't want to steal Dr. Wolfus's thunder, so I'm hoping he can join us for if this meeting goes that long. If not, we'll have him at our next meeting to actually talk about the program and how it started. I think it's been going for about 12 years now, 10 or 12 years, and appears to be very successful and interesting as far as maybe potential opportunities in California. Dr. Wolfus, Greg, he's the director of the program. He's also a Berkeley grad, so he has some California roots. So I don't know if that will encourage him to help us even more, but we'll see. So but I'll move right along then, since hopefully he'll be able to join us here shortly if we go that far. Next slide, you can show the next slide. This is another program that I was made aware of that is a program that's actually focused in rural communities, and it is a model that's based on philanthropic fundraising, but it has distributed a lot of pet food and supplies and basic wellness and emergency care to animals in rural areas. So we might want to learn more about how they operate and what they do. And then next slide, please. And again, this is, since I do have a large animal background, this is something I'm aware of. It is the Veterinary Medical Loan Repayment Program. It is funded by the USDA through NIFA, and it will pay up to $25,000 a year to a recent graduate who agrees to go serve in a designated veterinarian shortage area. They need to work for 3 years in that area. If you could go to the next slide, I think it has some more of the information on it. So last year, there were 6 areas that were documented areas of need for food animal medicine. Again, I circled the FTE, so they only need to provide 30% of a full-time equivalent. In other words, They can practice on small animals or any other community need for the other 70% of the time, but they are required to spend 30% of a 40-hour work week serving beef cattle, small ruminants. They can also include, swine or dairy cattle, but basically food animal. This is a very important role, not only because the animal owners are in dire need of assistance, but also from a human health risk standpoint, a zoonotic health risk. And we had 6 positions. I think four of those last year were in different counties in California that had no veterinary care for the food animal population. And 2 of them were out of the state lab system. And this year there are there are 8 places. 6 of them are in counties that have underrepresented veterinarians, no veterinarians that do any food animal work, or very few. And then the other 2 are actually state lab positions that are considered high risk, that we don't have those positions filled. And to my knowledge, we just don't have any interest in this, or we haven't awarded these positions last year or this year. I'm not sure about the years before that. So this is another area where we really do have a problem with access to care for animals. And it appears that even offering a total of $75,000 of loan forgiveness hasn't really attracted veterinary help in these areas. So another something to do a little research on, and I think one of the things we really need to do is document the need and document what's actually what the issues are for the state of California. And we don't have any data specifically, I think, for California. And I think it would really behoove us to try to collect that data and get that information as we move forward. I think that's important. So I'd like to open it up for comments on these last 2 items, public comment.
All right, this is the moderator, and at the direction of the task force, I've opened up the Q&A panel for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. All right, it looks like we have a request from Dr. Zara Hedge. I will request to unmute your microphone. Please click that unmute me button when the prompt appears. All right, you are unmuted.
All right, thanks. I'm Dr. Zara Hedge. I'm Chief Medical Officer at San Diego Humane Society. I had a quick comment. I work as a contract vet for RAVs, and I'd be happy if you want somebody to come and talk about that program at a future meeting to help get that set up. Also, with regards to Tufts at Tech, I'm in frequent contact with Dr. Wolf, so I know him quite well. But there's a program at Western University of Health Sciences that I helped set up when I used to work there as a professor, and we basically, it's a very similar model. It's not in a school, but it's associated with LA Animal Services. So we contract out a clinic, teach veterinary students, and provide affordable care. And so that might be a great resource as well. And my question was, if you have reached out to clinics that are providing accessible and affordable veterinary care throughout California, if you've got a list or if you need help creating a list, because I'm somewhat familiar with Southern California, but I think we could gather a lot of information and learn from clinics that are already running here in California.
Great, thank you very much for speaking. And we actually invited Dr. Nelson or his representative. I don't know if he has come to I haven't looked at the attendees list, but we did invite Western to join us. I'm not sure if they were able to make it, but we would very much like to start a list and pursue gathering that information. I know even here at I do work at Cal Poly State University, and we have a community veterinary services enterprise, and we do service the homeless shelter, the human homeless shelter here twice a month with free veterinary services through our program. I know there's a lot of those things around, and I would love to try to gather some of that data, and it sounds like you would be a great resource.
Yeah, I'd be happy to try to put together at least the ones that I know here. I've worked in LA and San Diego, so I don't know much about the rest of the state, but I'd be happy to try to help in whatever way is good for you all to collect that information.
Great. That's awesome. What do you think, Diana? Does that sound like a good idea to you too?
Yeah, that sounds like a great idea. Thank you. And then I just wanted to, I don't know if the moderator reads the notes or if I should read a note that was in here, or if Marissa wanted to state her note that's in the Q&A. Sorry, moderator. I'm taking over your
No
job.
worries. I was actually just about to request to unmute her microphone. So let me find her in my attendee list. All right, Marissa, I'm going to request to unmute your microphone. Please click that unmute me button when the prompt appears. All right, you are unmuted.
This platform I'm not very familiar with, so I wanted to get my note out while the comment period was open. This is Dr. Marissa Silva from the California Department of Food and Agriculture. I just wanted to mention that the VMLRP does not need to be a new graduate. I saw that pop up on the slides. It can be anyone with student loans that can be receive this charge payment directly to them. We are actually currently taking nominations for areas within California that might qualify for a nomination. I can put a link in the chat for our nomination survey, as well as our email address that you can contact us directly. We would be able to take nominations up until the end of October so that we can prepare them for the November submission deadline. And we did actually get a contract offered for a position within California this year, which is very exciting, up in Modoc County. The veterinarian still has to accept the nomination. It's just an offer at this point, but we were really heartened to see that. So wanted to share that with the committee. So thank you for the opportunity to speak.
Thank you, Marissa, and hello, nice to hear your voice.
Good to see you.
Could you help us? I should have reached out to you earlier. Could you help us with, do you know what's going on nationally with this program? Has it been pretty well filled, the positions, or is it something that is a struggle across the country? Do you know?
We're actually in contact with the National Committee to discuss this this week, actually, so I can give you more detail after that. But they have had I guess, leadership change, and with their move to Manhattan, Kansas. So they are reevaluating all of the programs, and we are aware that we have not had a ton of applicants apply for our shortage nomination areas, and so are looking for ways to encourage that, we've directly reached out to both of the vet schools in California to see, why students aren't currently applying for these nomination areas. But yeah, it sounds like they're looking at it at a national level to encourage people to apply. I know it's a very particular type of person that wants to apply for this program. It is, additional paperwork, but one of the misconceptions is that they don't pay for, or that you'll be taxed on this 75K, but they're actually promoting that you will get additional tax money to offset that. So it's not 75K minus taxes, it's 75K plus taxes, which is pretty exciting.
Yeah, nice. Do you think we could help with more education about this program? Is that part of the barrier, is just educating veterinarians about it, or?
Yeah, I think educating veterinarians about it, as well as a lot of the nomination areas that are successful, a community comes together to put forward a nomination and is already actively recruiting people to fulfill that nomination area. I think it can be quite daunting for an applicant to apply for a nomination area where they're not familiar with the region. We have nominations both at the very top and the very bottom of California, and if you're not from there, it can feel quite, daunting to apply and then have to set up a practice and prove that you are serving that area. So I think the most fertile ground for this is communities that are really engaged either with a vet school, recruiting, or already have a veterinarian. It can be used for retention too. So if a veterinarian is in a community and is just not making money, they can submit a nomination area and the community can come around them to help them stay.
Great, that's very great information. Thank you for sharing and joining us.
Happy to help.
Okay, well, that's really what I had today. Diane, do you have anything you'd like to add as far as next steps or where you'd like to go from here?
This is the moderator. We do have another request for public
I'm
comment.
sorry.
That's
Right, I'm
okay.
not keeping track. I don't see them show up, I guess. So thank you.
Individual identified as Robin Post. Robin, I'll request to unmute your microphone. Please click that unmute me button when the prompt appears. All right, you are unmuted.
Hi, I work at a high volume spay neuter clinic that's low cost, as well as an emergency surgery clinic where we do a lot of emergency surgeries that are referred from local ERs and specialties. And I can help with a Northern California list of clinics doing this kind of work that we're doing. There's not very many, but at least we could maybe get started with the list of a Northern California groups that are offering low cost surgery that prevent euthanasia or surrender to shelters if you wanted help with that.
Yeah, great. That sounds great. And I think that's, in my mind, that's probably the first step, is that we actually start gathering a list of clinics and veterinarians and people that are involved in this arena, and trying, at that point, trying to find contacts and then ask them for more contacts so we can get a fairly robust group to poll. And then I think the next step, and you can correct me if I'm wrong, Dan, but then the next step is to poll these people so that we have an idea of what's happening in California and what the need might be in specific to California and regionally in California. Comments on that? I will say this is easier to do in person than I feel like it's hard to have a discussion on a Zoom call. I apologize for that. It's I know loses a lot in community feel.
This is the moderator. Appears there are no further requests for public comment. Would you like me to close that Q&A panel?
Yes, for now. Thank you. So I think at this point, I would love to open it up to any other further discussions regarding the next steps. I would suggest that our next steps would be to use several of the attendees as a springboard for more information gathering. I would like, and I appreciate Dr. Roth and Dr. Post and Dr. Silva and others that have commented. I think we should try to put together a list of people we can contact to start gathering information about what is happening in California, and what, perhaps putting some semi-quantitative numbers on what the need is, not just for the whole state, but even regionally. You made a mention, Dr. Roth, I believe that, no, maybe it was, I'm sorry, I wrote my notes and I can't read my writing. Dr. Hodge, I think it was, mentioned that you felt comfortable with the list down in LA and San Diego, but it's possible that we can use other people's, including Dr. Post, to try to find people in the northern part of the state. I think it would be helpful to know where the greatest needs are also. And then the other challenge that I feel like we have is, what can we as a veterinary medical board do to encourage and support solutions to this? And we have a fairly, narrow mission compared to the problem. The problem is complex and is multifactorial and has a lot of socioeconomic nuances in it, I think. And so I think it's really important that we not only do our part, but try to help encourage other organizations and support them in doing their part as well. Comments, Diane?
Yeah, I think those are great next steps, and I appreciate those that have volunteered themselves to help us with that. And with also, what would be great to know is, yes, who was already involved, and if at all possible, what is the demographic of folks that it is that you are helping, socioeconomic, ethnic, so we can better understand who is able to access vet care and who isn't able to access vet care, even in the places where there is something available for those. So to the extent that's possible, that'd be great for next steps. And then just, feel free to reach out with any ideas. Are we allowed to say that? Any thoughts? And really, this is an open forum and an open discussion that, just like Grant Miller was stating earlier, where this is the early stages. And so we're really here to listen, to gather information, and to then use that to make concrete steps to be able to bridge that gap to access to veterinary services.
Yeah, sometimes it's a bit daunting because I know as a veterinarian, I want to come with answers. I don't like walking into a room and not knowing how to treat a patient and not knowing. So it's hard to kind of open your mind and say, okay, we're just starting to collect ideas and data and information. And we don't have an answer today. We're actually at least having the discussion and starting that process of exploration. And I know that Diane is very committed. I may be off the board by then, I don't know, but I know Diane is very committed in keeping the torch lit and moving forward with this. The other thing I didn't really mention, but the Access to Veterinary Care report talked a bit about standards of care and how that standards of care can be a barrier to service, to veterinary access to care also. And so that is an area where we actually play a pretty large role in determining standards of care. And that's probably needs to be part of this conversation, even though it's complex, I think, but it is a part of the conversation. So anyway, any other public comment? Because I want to make sure people have a chance to say anything regarding our next steps. So if we could open that up and see if anyone else has ideas on next steps and where we go from here.
All right, this is the moderator, and at the direction of the task force, I have opened up that Q&A feature for public comment again. Members of the public, if you would like to make any comments, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. I'll go ahead and pause a moment to allow the public time to access that Q&A panel and submit their requests. All right, looks like we have a request from Dr. Hedge. Dr. Hedge, I'm going to request to unmute your microphone. Please click that unmute me button when the prompt appears. All right, and you are unmuted.
Well, thanks. I was just sharing that there was, and maybe you all saw this, a recent Viewpoint article in JAVMA on spectrum of care and teaching that students. So that might be something that might be good if you haven't seen it to check out when we get to topics or talking about various levels of care, because that definitely, I think, can be a barrier and probably is, especially here in California. But I think this article really lays out that the spectrum of care levels do not mean worse or unacceptable care. So just throwing that out there is a good article.
Thank you for bringing that up. And actually, I have not read that. It's on my list of things to read. So I appreciate that and that comment. I think it's a great one.
This is the moderator. It appears there are no further requests for public comment. Would you like me to close that Q&A panel?
Yes, thank you very much.
Okay.
So I do have a list of people I'm going to reach out to today that have indicated a willingness to help us with this. So we will be doing that, and I will schedule Dr. Wolfus, Greg Wolfus, to speak with us at a later date. But we will also be gathering information from him as well. Anything else to add, Diane?
Just I'm excited about this. Thank you everybody for spending their morning with us. And you know, and I also just remembered, like, you know, being able to also hear from students and RVTs would be great. So I'm just putting that out there for those that are here to put out the feelers for, I'd love to hear from veterinary students and also RVTs. Would be a great folks to hear from as well.
And I would say that we are definitely open to any other comments outside of this meeting time. So both Diane and I would be happy to take any emails or phone calls or whatever you have to talk about this. So we're very interested in your ideas and your input. So, okay, with that, I'm going to go ahead and I think close the session. But again, I echo what Diane said. Thank you so much for joining us and for being concerned and interested in this issue. So thank you.
Thank you, everyone.